So just briefly about my background in healthcare and AI, I spent about 16 years in AI, kind of dating myself here. 7 of them are in healthcare. I spent my starting of the career in nuance communications, building out EHR, medical transcription, actually building out specific clinician models for each of the clinicians that we had. I think there was 200,000 of them that we were building daily models for. And a lot of that work inspired personal AI today. Also worked with Kaiser Permanente, Department of Research on both clinical and operational side. Did predictive analytics for readmission rates, how to eliminate or reduce that, and also worked on just predicting certain cancers out of the pathology reports as well as heart disease. Spent last 4 years co-founding and building personal AI. We are both a consumer-facing as well as a B2B-facing product. For the B2B sector, we largely operate on 3 verticals. One, of course, is healthcare, one is legal, and the other one is finance. So this is my agenda today. I think Alex already covered a lot of the first point, which is what is a digital twin as defined by the wider definition acceptable today. And the second part, I wanted to spend time on, what does it mean for us building a digital twin of a clinician at Personal AI? And really go under the hood a little bit of how we build this. But last but not least, it's my favorite part, which is talking about customers and use cases that we have been seeing in healthcare thus far. So the first thing, of course, is what is digital twin? I did want to open up the floor a bit. If you could use the chat functionality, just answer these 2 questions, maybe take like 30 seconds. First, what does a digital twin really mean to you? And then second one, how would you use your digital twin if you had your own? So just wait for 30 seconds for everyone to do the process and answer. Mm. All right, I'm gonna move on. I think Alex already talked about this in detail, so I just briefly reemphasize again. Basically, a digital twin is a digital replica of any object, process, or person. And of course, being personal AI, we're definitely replicating the person entity. The second part of it is I love how it was emphasized that this means you want to connect to real data sources that in real time and being able to update in real time to predict based on both current and historical data. So those things I think also are very important. Second, I want to talk a little bit about like what does a digital twin mean to us in the personalized space. So first, what is a personalized digital twin? What we do is we build private models of an individual or an organization. So there's 3 things that we really care about. The first thing, of course, is accuracy to your memory or your information. So this is really any kind of data that you might consume into your personal AI or your organization's personal AI. The second part of this is we want this to be authentic to your mental models and your communication style. So one big use case for personal AI right now is essentially retaining information, recalling information, as well as communicating that information and sharing it with outside world, whether that's other patients, clinicians, or your staff, right? So this is essentially how we think about building a model of you. And the third is really thinking about this side of attribution. So what I mean by that is if you imagine LLM, or even if I build on top of the data of everyone here today, right, you will get a general model where it's very difficult to tell who has said what, which mental model belongs to Alex and how he diagnosed things, and which mental model belongs to me and how I think about things, right? So the reason why we build these individual models is because then we can say clearly who has had these thoughts and really encourage that diversity of thought. And then the second part of this is really connected to the real-time data source part, such as where your documents may live, your emails, your other communications through SMS or other messaging apps, to create that essential memory for your digital twin. And the second part of this, I think Alex also mentioned a lot about the continuous nature and really learning from the real-time feedback. So for a large language model, especially fine-tuned models, it's very hard for it to adapt to real-time information and incorporate real-time knowledge rapidly, right? So the system that we have built is that you can adapt to any kind of user feedback in real time, and it's directly integrated into the model itself. So why have one, right? So I like this illustration because it makes it very clear, LLM versus what we're building, which we'll call a personal language model for the individual. So really, LLM is an aggregation of all the world's knowledge based on, the medical data corpus, right? So what we want to build is mimic the mental models of each person, and you can still have the benefit of querying all of them at once, right? Except for you would get individual thoughts rather than a aggregation of thoughts. And the second part, I want to talk about why do our users come to us, right? And the first thing is that proprietary knowledge is very important. So if you think about the different industries, whether that's healthcare or law, legal, as well as finance, there's a lot of proprietary knowledge that is private to them. So they want to keep this data private and confidential, right? And this data is also very difficult to get from a public corpus. The second thing is they want to scale communication, right? One is to have their staff or their clients or their patient being able to access their brain 24/7 without them actually staying awake 24/7, of course. And that's via email, SMS, or direct messages that they can have this 24/7 interaction with their patients or their clients. And the third thing is, right, you may ask, why would I want my AI to represent me and maybe sending wrong information to some people, etc., right? But what is valuable is that you have full control over whether the AI responds, when the AI responds, and then you also have the control to modify the response before it's sent, right? So imagine a scenario where I'm asking my doctor a certain question about my past medical visit. Then my doctor actually have the chance to review that response before he or she sends the response. So that's how the system is constructed. And of course, once they modify the response, that's actually going back into the feedback loop to be learned on for the digital twin for the next time. So how does it work? A little bit under the hood. We talked about the sense of real-time data and memory. So that's everything that is proprietary knowledge, that's social interaction from your messaging, that is author data. For example, if you are a clinician who also write books, those books can go into their research papers, et cetera, et cetera. Second thing is the model, which is kind of your personal AI. When we talk about authenticity and really being able to measure the transparency and accuracy of the model, we really approach it from 4 different dimensions, and we score each of the AI responses based on these 4 dimensions. So the accuracy score would indicate how accurate it is to your memory, whether it's directly coming from it or there's some interpretation on top of it. We're also measuring things like communication style, fluency, and relevance to the patient. To the user, sorry. The third and the fourth thing is how would you then take your personal AI somewhere else, right? So we have both the API integration, which some of our customer uses to embed into their product. And we also have native applications that we have developed, which I will show screenshot of later, that operates both on mobile web app as well as desktop app. So this allows the users to actually bring their community and have real-time interaction, managing both their memory and their models. And then this is just a deeper conceptually how this will work, right? So the step one is really training this personal AI or digital twin of you. So this is by adding any type of memory, by sending messages, or really just connecting your data sources. The second step, we think about engaging with your AI and then trying to improve the personal score that we're just talking about. So once your personal score hits a high, 80 and 90, it becomes a very accurate model for that specific topic or response. And the third step is you will review this co-pilot responses, what we call it. So these are essentially responses that your AI has drafted for you, but has not sent it. And once you review and edit these responses, it goes back into the tuning and reinforcement learning of your digital twin model. Okay, so now is the part that I'm most excited about, which is really talking about two use cases in healthcare. One on the individual digital twin level and the other one on the organizational digital twin level. So the first person I'm going to introduce is Paul. So Paul has been one of our early users for a very, very long time now. So his pain points is really he has a lot of cognitive overload for patient care because he runs his own clinic. He has to communicate with patients. He also have a lot of students who is coming to him to learn more about how to pass like American board exams. And then the second point is he has always stay up to date on the current researches in wound care, which is his specialty, and really understanding how that clinical protocol will work and operating in the bounds of that, right? So instead of me telling you how he is using personal AI, I'm gonna let him tell you himself. And please let me know if you don't hear the audio.
I could put in clinical scenarios. And then I would personally tell, in these cases, I want to treat, this is the algorithm that I want to use to treat this patient. So when I run into that situation, I could feed it in, and then it will tell me, okay, this is how you want to treat this. So just by having that information available already, I'm already thinking less. It's kind of like using the system to kind of help me guide there. But then now I'm telling it, okay, if you run into these cases, here's how I want to treat it. So then I feed that information in, it'll feed back, says, oh, okay. And they say, okay, the office staff may get a phone call from a patient and they say, okay, they would call us, say, what do you want to do now? But what one layer you could do is share that AI persona. They could do a triage on, here's his thought process on how he wants to treat this situation. So then it will reduce. So then you get that over and over again. Then it will reduce. It'll make the practice more efficient because they could, in essence, want to say read your brain. You're already telling it. In these cases, here's what we do. Here's our protocol on it. So that's where AI becomes part of it. I could put in clinical scenarios.
Well, okay, so Paul mentioned something called AI persona. I just wanted to briefly go through that, right? So this is how Paul's digital twin looks like, and keep in mind that he is an individual person with an extended team in his clinic. So we have this concept called the primary AI. So essentially, primary AI is a union of all of your AI personas. So think about each AI persona as something that manages one group of data for you, and you want to share that persona with a specific group of people, right? So the first use case that he talked about is using his persona as a digital clinical companion, essentially feeding a clinical protocol, scenarios, how to treat patients, and then being able to share this persona with his team. So when his team are getting questions, they can directly tap into, I guess, a digital Paul without having to ask him the same questions all the time, right? So that is one example. And of course, you can have other personas under that primary AI as well. One of which is, I mentioned, he operates as a medical teacher or a coach for people who are coming into the United States and then trying to pass the American bar exam. Right. So he can share with his students 24/7 advice on like how to do best practices, FAQs, how do you approach these type of questions on the American bar exam. So that is shared with a different people as well as a different corpus of knowledge. And keep in mind, all of these personas have their own separate memory stores, and so they've never crossed with each other. So the next use case I want to address is more of a operation use case. So Lean 365, they're a clinical operation continuous improvement firm. Essentially, the pain point of their clients, which are these hospital entities or departments, is that every hospital goes through these very specific process improvement project every year. So it takes around like 3 to 4 months of a group of people's time to be able to do that, right? And the other pain point is around 80% of these projects already done before in the previous years. It's just they're on paper or the person who has conducted them has left the hospital, so no one knew, right? So essentially they're wasting resources on repeating the same type of projects every year. And then their use case is that each of their clients, so each of these hospital entities have a very specific knowledge and implementation plan on how they want to approach, say, how do I optimize wait time in emergency room, right? And then they also want to solve this discoverability of past projects so they don't have to duplicate efforts, or they can get directly into the implementation rather than the discovery and planning part of it, right? So the ROI they're really seeing is being able to shorten the project timeline from 10 weeks to 7 weeks, which essentially eliminates the 3 week of discovery time. And that is equivalent to a time saving or monetary saving of $10,000 per project. And this is what a Lean 365 organizational digital twin will look like. So Lean 365, which they name their AI Sage AI, would be sitting on the top. So this essentially encompasses the corpus of all the different hospital entities under it, right? So for example, hospital entity 1, A, and B could have different PDCA procedures, different projects they have done in the past, different ways and different owners of the project that they want to approach, how to do their future projects, right? So each of these hospital entities essentially will construct their own digital twin managed by Lean 365, right? You can also go down to the department level where you're capturing emergency room specific PDCA procedures that's relevant for that, right? So in this case, the data and the scope and the model would be only under that emergency room department. So I hope that's clear. The last but not least, I just want to emphasize that the same thing Alex talked about. Really, I think in healthcare, legal, and finance is very important to really understand who is owning the data. Are they training on the data? How the data is being used? Once you're giving these data to different modeling companies, and also compliance and privacy is a huge part of this. So understanding how the data is protected or how your patient's data is protected is very important. And of course, just to be transparent, we're not yet HIPAA compliant. We're very close. So we're going to be doing that in the next month or so. All right. Thank you. And if you want to know more about the healthcare use case for digital twins, please head to personal.ai/help.